because then it's going to ruin the whole thing.
Oh no. It'll be better once the room quiets down.
How about here?
Let's just wait a few more minutes. There's still some people coming in. Just give them a few more minutes and we'll get started. Let's get started. Hello everyone, my name is Yifang Zhu. I'm a professor in the Department of Environmental Health Science department here at Ying-Ying School of Public Health. It is my great pleasure to welcome all of you to be here today and for the special second series of UCLA Ying-Ying School of Public Health Grand Rounds. So today our session co-hosted by UCLA Center for Health Policy Research is to address the impacts of the proposed federal budget cuts on the public health and on the environment. We all know on March 16th this year, President Trump proposed his first budget blueprints. And in that, he proposed to cut off entirely the budget for several agencies that include Chemical Safety Board, NASA's Education Program, and the State Energy Program, just to name a few. Right. In this proposal, Trump also proposed steep double-digit cuts for several agencies, including the National Institute of Health, the Department of Education, Transportation, Labor, and others. And the Environmental Protection Agency, the EPA, is arguably the hardest hit agency in this proposed budget. Trump wants to cut EPA budget by almost a third. So this will bring EPA's budget down to about $5.7 billion, its lowest in 40 years, adjusted for inflation. And we all know that the EPA's mission is to protect the environment and protect human health. That's why we're gathering together today here to hear from a very distinct panelist of experts about their view on the impacts of this proposed federal budget cuts on the environment and on human health. So let me first introduce our panelists. Our first panelist is Dr. Michael Jerrett. Dr. Jerrett is professor and chair of the Environmental Health Science Department here at UCLA School of Public Health. He's also the director for Center for Occupational and Environmental Health. Dr. Jerrett is a world-renowned expert in GIS for exposure assessment and for spatial epidemiology. He also serves on the EPA's Clean Air Scientific Advisory Subcommittee for nitrogen oxides. Our next panelist is Dr. Tim Malloy. He's professor and in both the law school here at UCLA and also in the Environmental Health Science Department affiliated faculty. He also serves as the faculty director for UCLA Sustainability Technology Policy Program. His research focuses on the environmental, chemical, and nanotoxicology policies, regulatory policies, and organization theory, decision analysis. Professor Malloy has worked for 11 years in private sectors and for US EPA Region 3 before he joined UCLA. Our last panelist is Dr. Ying-Ying Meng. Ying-Ying is a senior research scientist at UCLA Center for Health Research Policy. And she is also a co-director for the chronic disease program. Her research focuses on the access to care and the care quality of the care with emphasis on those minority groups and especially those with chronic diseases. She has worked as the principal investigator for several multi-year epidemiology studies looking at the impacts of air pollution on asthma. She is the lead evaluator on several federal EPA-funded and state-funded research projects. So we'll start with each panelist to give about a 4-minute introduction, and then we'll open up to the audience for questions and answers and discussion. So please note, we want to provide opportunity to as many people as possible to ask questions. So we'll be limiting each questionnaire to 1 short question. Thank you for your understanding. And with that, let's welcome our first speaker, Dr. Jerrett.
Thank you, Yifang, for that very kind introduction and a thoughtful summary of the cuts to the EPA. I want to talk a little bit and put this in historical perspective. Since the inception of the EPA, we have never seen such large budget cuts proposed. And I went back through the literature to see what happened under President Reagan's term, because he's widely cited as having introduced the largest cuts ever to the agency. So we now have a proposed cut of 31%, and estimates that the cuts in California will be 60% for Region 9 of the EPA. So this is really an unprecedented event in American history and in the history of environmental protection. And what we know from the earlier Reagan cuts is that they can have lasting effects, generationally long effects. And one example would be the noise office. President Reagan closed the EPA's noise office, and we now have a hodgepodge of local and state regulations, none of which are meeting World Health Organization standards. We don't have the ability to study noise the same way they do in Europe, because in Europe they mandate that every major city has to have a noise map that can be linked for health studies. We don't have that capacity. I'm just finishing off a study on 13 American cities and 37,000 African American women, and we've taken 5 years to get the noise estimates together, and we're still not finished. So that tells you just how hard it is in the United States to study a public health issue from now, which we have huge evidence that it affects public health. Environmental regulations have been very successful in cleaning up the quality of our air, water, and land. And this just shows a nice plot that was in a recent New England Journal of Medicine paper led by Jonathan Samet, who's a chair of preventive medicine at USC. And you can see here that for every single criteria air pollutant, we've had significant reductions, and this dotted line just shows the percent that they are under standard, so below standard. So for almost all the major air pollutants now, we're below national standards or just about at them. Now there are exceptions, like California. We have many areas that are out of attainment for ozone. So there's still much work to be done, but I think this speaks to the importance of environmental regulations for protecting public health. Now, I've heard Dan Costa, who used to be the director of the Office of Research and Development at the EPA, say this many times. 65 to 70% of the health benefits that you can put into monetary terms in any given year in the US for all government regulations, so aircraft safety, food and drug regulations, everything that we do to regulate and protect our health, 65 to 70% of the benefits accrue from reductions to particulate air pollution. So the science here to support these decisions is extremely sound, and reducing resources to EPA so drastically will limit the ability to implement regulations that will have public health benefits. And it's quite likely, when we can't enforce our regulations, that we're going to see some of those trend lines start going up again, and will have definite impacts on public health. Regulations also benefit industries because they can create a stable and predictable environment. So when the regulators cannot do their job, it slows down the regulatory process and creates great uncertainties for many industries that are otherwise trying to do the right thing. So in this instance, we are also likely to exert harms on our economy as well as our health. And then finally, I just want to note that science is very important to environmental policy. So I just sat for 3.5 years on the Clean Air Scientific Advisory Committee subcommittee, as Yifang mentioned. We went through literally thousands of studies to come to our conclusions. And in this instance, our conclusion was we shouldn't change the standards. We shouldn't lower them or increase them. We should leave them where they are because they were adequately protected. So there's a case where the science informed a decision that said no change. So, I mean, a lot of people were probably happy that they didn't have to make those changes. And there are also very large cuts proposed in National Institutes of Health, about 18.5%. National Institutes of Health spends literally billions of dollars supporting scientific research on the environmental origins of human disease. So that's going to greatly reduce the quality and the amount of scientific knowledge we have to protect public health. And I think my time's up, so let me pass this over to Dr. Malloy.
Thanks, Mike. Thanks for a great start. Welcome, everybody. I'm going to start, and I'm going to end with a quote from my father. The first thing my father used to always say is, it could always be a lot worse. Okay, so we'll start with that one. It could always be a lot worse. Look, the whole budget thing here, I think, kind of reflects the interwoven nature of science, policy, and law. And I'm going to give you a few demonstrations of that as we talk about the EPA, the proposed budget as it exists right now. And along the way, I'm going to make 3 points. First, it was already bad. Okay, the EPA budget was never really very good. So it's always been bad. So let's not kid ourselves that the Obama administration had fully funded EPA and was bringing these programs to the potential that they could, because they hadn't. It's going to get a lot worse. And Mike talked about a few examples. I'll show you a few more examples that relate to science and law and the role that it will play. And then my last point is going to be, but it's not going to be as bad as it looks right now. And I'll explain why that's the case. So let's start with the first one. It was already bad. Look, the EPA budget had taken hits during the Obama administration in a variety of programs. We were already on a downward slide. So take the Office of Research and Development. The 2016 budget for that office was at the lowest point it had been since 2004. So let's not kid ourselves that, prior to this, we were a shining example of how to fund science. We weren't. And EPA generally has been historically underfunded. And I'm talking about core programs like the Clean Air Act, the Toxic Substances Control Act. All these core programs operated so badly because we have never, not in a Democratic administration and not a Republican administration, funded them to the extent that they needed to be in order to operate properly. Okay, it's bad news, right? Worse news. March, the proposed budget comes out, and let's look at the goal that was presented by the administration. They had two goals, actually three goals, two that they trumpeted. One was to devolve authority to the states, right? To move this kind of intrusion of the federal government, put regulation back at the state and local level where people could make decisions based on local conditions, right? The other one was to focus again on our core functions, air, water, chemicals, and to eliminate voluntary activities. That sounds great. I mean, we could argue with cooperative federalism, that's what we're built on, right? The problem, of course, is that cooperative federalism depends on states having capacity, having the institutional capacity, but having the funding. And there is where we run into the hypocrisy of the goals as stated for the new proposal. Let me give you a couple examples. The first I'm going to talk is a favorite of mine is enforcement. Environmental programs don't work without enforcement, right? So some of the major cuts in the program budgets are for inspections, for litigation. So we're still going to have lawyers, we're going to still have inspectors, but not as many as we used to, and they will not have the money to fund inspections and litigation. When you don't have enforcement, you don't have compliance. So we're going to see drops in compliance and the environmental implications that flow from that. And the states will not pick up the slack there because the funding for states to engage enforcement comes from EPA grants, the very grants that are going to be cut as part of the proposal. So it's a cycle here. There's no cooperative federalism because there's going to be no state action. But ORD suffers the biggest hits. So the Office of Research and Development, which is key to policy implementation and even to enforcement, that office will be reduced by 40%. So from $510 million down to $290 million. Let me tell you a couple of the programs that will be cut. the STAR program, Science to Achieve Results. So $50 million to fund graduate students and early career scientists doing environmental science research. The Integrated Risk Information System, or IRIS, which supports risk assessments at the state and federal level, will be cut. The Chemical Safety and Sustainability Program, which drives the development of the new toxicology, predictive toxicology that's necessary to support implementation of the recently reformed Toxic Substances Control Act, and the Endocrine Disruptor Screening Program, which is really a wonderful example of science at the cutting edge, linking with policy, cut. All right, so these cuts have short-term implications, as Mike said, but they also have long-term implications in that they undermine institutional capacity of the agency for years forward. All right, last point. It's not going to be so bad, and here's the reason. It's a proposal. It's got to make its way through Congress, and I would like to say that rational minds will rise to the challenge and that will make some decisions based on good government policy. Fortunately, I don't think that's going to happen. There will be a level of rationality, but it's going to be economic rationality. And here's what may save a lot of these programs. EPA is very good at spreading the money. So think about ORD, for example. That money's not sitting in Washington. A lot of that money is out in 14 or 15 different laboratories across the country. North Carolina's a wonderful example. Think about North Carolina. That state is set to lose about $60 million in state grants to run their own programs, to build infrastructure, to help with clean water, right? So there's going to be political pushback from North Carolina on this. And in Research Triangle Park, where a lot of the ORD facilities are built, we have contractors where a lot of that money moves. We have infrastructure in that area, a lot of employment in North Carolina because of ORD. And I think that's the kind of rational reaction that you're going to have as people begin to look around and see how the hit will affect their local community and their state. We're going to see pushback from Republicans as well as Democrats. So I started with my dad's quote, said, you know, things could always be worse. And I'm with the last quote, which I hope the administration takes into account, is that sometimes cheap is too expensive. Thank you.
This one? Okay. So I will talk about a case study to illustrate the impact of EPA budget cut on California's air and health. So as the previous panelists mentioned, there's a lot cut and in many areas. And for instance, lots of projects will be totally defunded, such as diesel emission reduction grants, clean power plan, and the environment justice fund. And then all the other categorical grants to the state and the tribes will be cut by 30%. So I would like to talk about a success story in California. So we all know that California has many ports, import and export the goods for U.S. And these imports and exports generate lots of pollutions. So in 2006, California Air Resource Board and the local air quality management districts approved an emission reduction plan for ports and the goods movement. There are about 200 different actions, and it costs about 6 to 10 billion with partial funding from EPA. And the strategies include the regulatory actions, incentive program such as help the truck company to retrofitting their engines, and also have encouraged the ocean vessel to use the shore-based electric power, and also have an incentive program for the cargo handling equipment companies. So our study is one of the a study commissioned by the Congress that try to see whether the improvement of all this environment investment improve the air as well as the health. And so we divided our study area into three areas. One is we call the goods movement corridor, those mainly the areas surrounding the port, rail yards, as well as the truck dominant freeways. And the non-goods movement corridor are mostly the freeways dominated by the cars. And then the control areas, mostly residential areas. So our study found that the traffic-related emission reduced with the cargo volume up and down in these years. And this data are fresh, hot off, not hot off the press, actually hot off the statistics software. So it really showed the Medicare enrollees living near the goods movement corridor has experienced the greatest reduction, and their level of exposure are similar to those at the controls and the non-goods movement corridors. And then additionally, with the reduction in exposure, their ED visits and hospitalization decrease. So my question is that to you all is this the worthwhile investment? Sure it is, right? And if we don't do that, then the health in California will be worse, as well as the nation as well, because those trains and the trucks, as well as the emission travels. Thank you.
So thanks to our panelists, and we'll welcome you up to the front so we can start the question, answer, and discussion. So now we'll open up to the audience. I know some of you have great questions. This is it's time to share your thoughts and your perspectives with our distinguished panelists. Questions? There's one question over there.
I'm curious about the global impact of the budget cut. And it seems that we originally have a good plan for climate change problems, and now the United States have a tendency to reverse their policy against the climate change. So my question is it likely that other countries such as China keep their position against the climate change? And my second question is, if China or other countries make a more progress position, have a more progress position against this problem, can we still address climate change problems?
I think it's maybe too early to tell what's going to happen on climate change because, I mean, if you follow the signals from the U.S., it's not clear. It's clear that we're going to be taking apart or attempting to take apart the Clean Power Plan and some of the other regulatory initiatives the Obama administration had put into place. But it's not clear what that means in the long run for efforts on climate change in the U.S. I'm pessimistic about it, but again, it's kind of a long game. We haven't officially backed out of anything yet, although it's hard to tell which way things are going to go. So I guess the best answer I can give is I think we have to wait and see what's going to happen. I think this is a particular area that's, especially at the global level, it's very difficult to predict with the various parties that are involved and the kind of shifting dynamic incentives involved, what nation states will actually do over the next few years.
Yeah, if I could just mention that I think, it erodes our moral legitimacy in the world when we cut back programs to United Nations internationally signed agreements. So it's not going to send the right message to other countries that they should be redoubling their efforts to ensure that we don't exceed the 1.5 degree increase by 2050. So I think that the the signal we're sending is one that we're not going to necessarily live up to our international agreements. And that is, as Tim points out, it's hard to predict how other countries are going to react to that. Hopefully they'll stick to their agreements and implement the Paris Accord.
You have any thoughts? All right. Any other questions? There's another question. It will be the next.
Thank you very much. I just want to ask, it's really great to see a legal mind with scientists sitting together. It shows, at least shows progress about North and South campus talking together. But what we really want to see is, how do you bring out all of this? How do you quantify this into action? How do you quantify this into action items that policymakers can use? How do you bring all of this into one paper or into one pager so a policymaker can use as an action item?
Well, first of all, you're welcome on behalf of North Campus. I wasn't sure, is the question, like, how do you take action on this issue of budget cuts and the impact they will have, or are you asking more broadly, how do you take action on integrating science and law?
Because they just presented some results, and so how do you translate those results into action items? So we want to see one page.
Oh, I see. So that's kind of a broader question about taking science and translating it into actionable policy. And that's a great question. I think there's an Office of Research and Development, which is the example I used in my talk, is a wonderful example of the difficulties, but also the possibilities by doing that kind of translation. So I'll give you an example. Here on campus, both in the public health school and elsewhere, people are working on developing these new forms of toxicological testing that are faster, don't involve the use of animals, so on and so forth. And a big problem is, how do you take the results of that and make it applicable in existing chemical programs, right? And it's turned out to be a lot harder than anybody thought it was. Number one, because you have kind of institutional inertia within a government agency. So not only do you need lawyers to think about the limitations of existing law and how to work within those to deploy the new science, but you also need sociologists, you need business management folks who can start to think at the institutional level, how do we integrate scientists with engineers and with regulators, right? So we tend to think about the divide being between law and science, but in fact, I think it's more complicated than that. It's between disciplines. So within science, we've got the engineering and the research and the regulatory folks, and they're not talking to one another. And then you have the overlay of the law on top of that. And the answer to how to like integrate those things, it's not writing a paper. I think it's interacting on a personal level constantly and developing a way of communicating across disciplines. It's important.
Yeah, I think our study could really provide empirical evidence, show that the air pollution control regulation not only improved air quality, but as well as the health. So it's a very strong message to the Congress, to the administration.
Right, great. Matthew Allison.
Oh, it's okay.
Okay, just to let you know, we also have audience that is listening online, so we also want to give them opportunity to ask their questions. So here is one of the online questions for our panelists. We talked about the federal, the state, and talk about specifically about California. So this question is about specifically LA. What are the implications of LA with this proposed federal budget cuts from federal EPA? And specifically EPA environmental justice funds. What's the impact on LA?
Well, you know, we've made tremendous progress in Los Angeles at improving air quality, improving a lot of major environmental contaminants that are coming through the water, through the land. But we still have many big challenges that remain unaddressed. And we've seen in the last year 2 environmental catastrophes, one at Aliso Canyon, where there was a huge uncontrolled gas leak for 110 days that led to the evacuation of 7,000 people and many thousands becoming ill as a result. And then the Exide closure of the battery plant, which is, the last time I checked with public health, they'd done 1,000 houses and survey for lead, and 999 of them exceeded federal standards. So we have a problem of an accumulation of impacts in specifically underprivileged neighborhoods. And that problem has not gone away, and that has not been well dealt with by the federal government as of yet. But they have instituted programs that specifically target environmental justice communities, and those are going to be on the chopping block. So I can't predict the exact impact that is going to occur in Los Angeles, but suffice to say, we still have a wide array of very complex environmental problems that are not addressed, and reductions in funding to either incentivize polluters to cut back or to force them to through legal sanctions are likely to lead to worse environmental conditions.
Yeah, and also my previous study and the others also show that the low-income minority tend to live in more polluted areas. So without those environment justice funding, that these population will be further impacted.
Great. Thanks, panelists. The next in-room question. The microphone is a little bit sketchy, so when you ask, make sure you leave a little space. Thank you.
Okay, thank you. Shortly after the EPA budget proposal was released in March, the former EPA administrator under both Nixon and Reagan released an op-ed in the New York Times, and he noted that the reason that he was asked to come back and take back up leadership of the EPA 20 some odd months into Reagan's tenure was because there had been these massive cuts at the EPA, and that had actually led to such a decrease in faith on the part of the public on environmental regulation that there was an urge to turn it around. And he mentioned in that before he took up the position, shortly before he took up the position, he had companies coming to him and saying, we need you to help restore the public's faith in the EPA as a regulating and administrative body. And I was curious if you guys know of any indication that there are private sector entities that may feel that this time, or if based upon the cuts or the proposed cuts, that there are certain industries that may face this problem more keenly than others, and whether that might be a place to find allies in an effort to get it refunded that's outside of the public health community.
It seems almost quaint to talk about the Reagan administration at this point. But I would have to say, you see smatterings of discussion about various industries that depend, particularly those who depend on regulatory approvals in order to take action, that those are the ones that you would likely see step up. So you might think about pesticide manufacturers, for example, or chemical companies. I would say my sense is that we shouldn't put much faith in corporate America making any significant or meaningful efforts to rebuild or protect the Environmental Protection Agency. I think we have to stop thinking about them as champions of sustainability, because what you can see happened prior to the election, when the reform of the Toxic Substance Control Act was underway, there was a real kind of warm feeling in Washington that everybody had come together and had that kind of hallelujah moment and saw that it was time to modernize our regulation and that the companies were going to step forward and take it seriously and such. After the election, almost immediately after the election, many of those major companies started backpedaling on all the commitments that they made under that statute. And I think that's probably the better, the truer sense of what we can expect from corporate America, beyond kind of the facile statements that you may see in their press releases. When push comes to shove, I think we're going to see that they're not going to step forward. And in fact, when you think about the internal budgeting in these companies, just as EPA starts to get defunded, I think what you're going to see is a parallel defunding within companies that move resources away from compliance and move resources away from sustainability, because there's an opportunity there to increase revenue in ways that don't require attention to those matters. So maybe I'm a little bit too cynical, but I don't think so.
I think, in a well-resourced state like California, I'm aware of high-level discussions that are going on at the governor's office that the governor and other senior aides are asking what can they do to backfill the loss of EPA funding. So they're seriously considering that. I think that it's unlikely we're going to see corporate America step up and start demanding more certain regulations. I think what we will see, though, is as these cuts get traction and they slow down the regulatory process to the point where somebody can't get an approval permit because the person that's dealing with that has 1,000 other permits that came in before that because they're now 1/10 the staff of what they used to be. You'll start seeing some kickback from that when the industries realize that when they do need an approval, they're not going to be able to get it in a timely manner. And I used to be an environmental regulator in Canada in the approvals branch, many very complex projects. And it was before the days of, I hate to date myself so much, but voicemail. So you had these little pins that one of your staff would, put the messages there. And I would get industries calling me up and saying, it's been 7 months since you responded to me, and I just can't wait anymore. Our company needs this approval. And I say, well, I'm looking at my stack of pins, and you're about 3 inches away in terms of little pink slips. So that's probably another 10 months, and I can't do anything about it. And that will start to have some impact where they'll realize that maybe these cuts are not necessarily to their benefit as well.
Great, thanks. Our next online question asks, does EPA have a list of which programs should get most priority for continuing in case the cuts are as severe as proposed? Or does the panelists have any thoughts about the priorities in EPA programs that should continue just in case the cuts proposed did happen, does happen?
To me, I really feel like those environment justice fund should be capped, and also the categorical money be capped, because it sounds the philosophy to cut the categorical money is that to give the state more autonomy in doing their work. But without the money, how they can do it, right? So it's very illogical to cut those categorical funds.
I guess I didn't understand the premise of the question. If I got the question right, the idea is, if there's going to be cuts, how should we prioritize those cuts in the best way? And I mean, that assumes that there's like a goal of prioritizing these programs in a way that advances public health interests, when in fact the whole point of this is to undermine the agency. So, the agency is under siege. Decisions are being made about cutting programs based, I think, primarily either on kind of blissful ignorance about how these programs benefit or cynical disregard for these programs. So the notion that somebody at the agency is, that there's a smaller pot of money and now we just have to use that more wisely, I think misses the point, which is the goal of these cuts is to undermine the ability to do these particular types of jobs. So, it's hard for me to kind of put an overlay on that in terms of how best to minimize that impact when the folks who are making those judgments, I don't believe, have that as a goal in mind.
Yes, right. Do you have other questions from the audience here?
Hi.
No, just get the mic over.
So there's a bill pending in the legislature called SB 49. It's authored by the Pro Tem and by Henry Stern. And the basic notion behind the bill is if they eliminate a regulation, we're going to enforce it here as it was before they eliminated it. Do you think the legislature or the governor can actually do that without huge budget increases on the part of California? At the same time, there's being budget decreases. And then the second thing is, how does the lack of federal research affect the ability of state agencies to implement new rules, like new toxicity standards for toxics that haven't been identified yet? Do you think that there's a capacity in the state of California to do that? So the idea behind the question is people in the legislature said we want to firewall California from the effects of federal changes under Trump. Can they really do that?
Well, I think that California is one of the few states that is probably in the position where they already have a very large environmental apparatus, and we have the air quality management districts, for example, that are representing sort of more local interests. So yes, it's possible it's going to be a multi-billion-dollar enterprise, and if they are going to do that, they're going to have to invest in a way that is going to drain funds away from other societally beneficial causes like education, affordable housing, and other types of environmental or coastal protections. So that, I think, is going to have a cost one way or the other. But certainly, yes, in California, it could probably be backstopped. But whether that can be done elsewhere in the country, and then you start to get into this race to the bottom, right, where other states start to say, well, come and locate your businesses here because we're easier to deal with in California. Now, on the second question, the research funding, there's a large amount of research funding that goes through the EPA. And I think what makes it different than the research funding that we would typically try to obtain from the National Institutes of Health is it's policy focused. So it's focused on supporting efficient regulatory structures and giving the policymakers and the decision makers the information they need to come to the best and most informed decisions about how to protect public health and the environment. So we're not going to see that kind of research coming out of National Institutes of Health studies because they tend to focus a lot more on basic biological mechanisms, the technology. Well, we don't know yet, as Tim pointed out, it may not be as bad as we think, but
and I think those are great questions. On the first question, I think it depends on which regs get, if in fact the federal government actually starts pruning away regs. That's a lot harder to do than it sounds. And ultimately, I mean, a lot of us have this thought that the EPA has all these regs and those are what are being implemented, when in fact most, not all, but many air, water regulations have already been delegated or authorized to the states. So a lot of the air regs that we have out there have parallel regs, like in California, the Air Resources Board or the Air Quality Management Districts are already implementing a lot of these federal regs. So it's really a question, I think, more of funding than kind of legal status and the availability of those regs, because what will happen is the money will go away that supports AQMD or Air Resources Board, and as Mike said, some judgments will have to be made about how to move money into that to support those programs. So I think that's what we're going to see. So certainly we have the ability to do that. Yeah, with respect to the second one, in a way, California, we're in so much better shape than most other states along this. I mean, when you think about our Office of Environmental and Human Health Assessment, CARB, we have a lot of really world-class research and capacity. So we're in nice shape there. I think with the impact of kind of the funding that goes away from ORD and other areas in EPA, that'll be kind of a slow walk, because I think there's kind of a pipeline of information. So think about the IRIS program, the Integrated Risk Assessment System. That over time gets updated, right? So there's a body of data there that can be used for risk assessment and for making judgments about human health impacts on chemicals. But if the funding goes away, that will not be updated, and so over time, the kind of the integrity and the scope of the available data that's out there will start to deteriorate. So I think it's going to be more of a slow motion car crash than having immediate effects. And I think the really hard part there is it's hard to get people excited about stuff that you can't point to and show them what's happening today, right? There's this kind of, we're able to absorb that. We don't feel it immediately, so we have this deterioration, and then it's too late by the point you realize where you are.
Right. I think when we have time to take one or two more questions. Question over there.
There's been a lot of executive orders put out by the president that has changed a lot of policies that were in place, like the pipeline in the middle of the country, and other executive orders that allows the coal companies to pollute the waters as they wish, practically. Comment on that and its relationship to California.
Yeah, you go.
Well, there have been so many executive orders issued, I have to be honest, I haven't been able to keep up with every single one of them. So certainly, we have a lot of evidence that burning coal is producing highly toxic fine particles that people inhale, and they become sick prematurely, and they die at an earlier age than they would have otherwise. So allowing for more coal, at this point, I think it has two major implications for California. We don't burn coal in California, but we are part of an integrated energy market where it may have knock-on effects where we are unintentionally purchasing across interstate lines some electricity that's been generated with coal. I think that, the pipeline is a fairly localized issue, so that's not going to probably have a major impact on us.
But there's a lot of other ones that have been instituted that are general throughout the country.
Yeah. So, I think some of the executive orders have been more symbolic than substantive. Some of them are going to be subject to legal challenge and may not be fully implemented. So again, it's sort of one of those cases where it's hard to predict the ultimate impact. One other quick thing I can mention, though, is if you implicitly subsidize coal by having lower regulations than you should otherwise, what you're doing there could have impacts for California too, because it's going to make renewable energy look like it's more expensive than it would be otherwise, because there are going to be external costs from the use of coal that are not going to be factored into the price, and that's going to make it less competitive for the renewable energy sector.
And, I'll say this about these executive orders, a lot of what you're seeing, it's a con, really. I mean, many of them are executive orders that call for the review of regulatory programs, right? So like many other things we see from the administration, it's really just facade. So what I predict is going to happen with a lot of these, put aside for the moment challenging the executive order directly, to unwind these regulations. The good news is you got to do the same stuff to unwind these regulations as you have to do to create them, and it typically takes a couple years to put a regulation into effect. And a disabled EPA with 20% less staff and career staff there who maybe are not as conscientious about their work as they might otherwise be, you could imagine them slow walking this regulatory review, and then the advance notice of proposed rulemaking, the proposed rule, review of public comments, then the rule comes out that might knock out an existing, say, air reg or water reg, then that gets appealed, it goes through litigation. We could be looking at 3 or 4 years before anything ever happens, and let's say 3-4 years, well, maybe other stuff that could happen could help us deal with that problem. So I think part of it is a sham, and it will take time before we actually see some of these regs kind of get formally undermined in that sense. And the other thing about coal, I agree with everything Mike said, and I think, let's keep in mind that there's lots of reasons why the coal industry is in decline, and economics has a lot to do with it. And there's study after study that shows that environmental regulation really does not play that big a role in the economics of many of these energy industries, and coal's no different. So hopefully, maybe we keep our fingers crossed that the economics will prevent an uptick in the amount of coal production and use in the U.S., hopefully.
Let's take the last question from our online audience so that we can end up on some more positive notes here. This question is asked about the panel suggestion or ideas for how academia, professional organizations, community organizations can use our voices, our limited resources to help support EPA in the future.
Yeah. Yeah, so definitely we should have our voice heard and we should publish our study findings as fast as we can, and also definitely like I say, if there's any opportunity to go for those testimony or the others, really have our voice heard.
Yeah, I agree. I think it's important to get that science out there through those normal channels, but I have to say I was heartened by the March for Science. Mm-hmm. And honestly, scientists out there, I think it's time for you to start translating for yourself what your results are and the impact of them are, and get out there and become activists, because honestly, with this administration and with the way the world is today, publishing another paper is important. I'm not saying it's not, but it's not going to convince anybody to fund EPA, to have another peer-reviewed article that shows the value of environmental regulation. We got a lot of those. What we need are scientists out there making noise and standing up for science and standing up for integrity in science. And, especially the young folks who are entering the field now, kind of capturing that energy and thinking about science as being more than what happens in the lab, but also what happens in the, the world of public discourse is so important now.
I think we're out of time.
I think we're running out of time. So many thanks to our incredible panelists and to all of you for coming here to engage in this important discussion. And as Tim noted, there's still hope. The budget proposal has to go through Congress first. So let's end up there. Thank you. Thank you all.